Tonight, I hope you guys have your journals out already. Tonight, it's really about uncovering the gems that are inside of you. Chronic pain, debilitating pain, frustrating pain can really take over and block our connection to ourselves. Of course, being in pain all the time, the emotional effect that has, and the way it affects our lifestyle. Sometimes we can feel like we're ruined. I have patients who tell me that they hate their body, or they hate the part of their body that has been causing them so much pain and grief. And we don't want that. We want to remain integrated and have a positive path of healing. I found this great Rumi quote and wanted to share with you. Where there is ruin, there is hope for a treasure. So if you do feel that way, I have patients who will come and tell me after they take all their pain medications, and that's generally like the pharmaceuticals, their pain score is still a 7 or an 8. So that tells us so many things there. So you're taking medication, you're suffering from the side effects, you're not improving as much as you think or hope that you would. And that's a really big reason why people can start losing hope on their journey with their pain. So remembering that where there is room, there is hope for a treasure. And a good place to start is asking yourself, what do you like most about yourself? And that's a question that we're not really taught to think about. We're not really, we never do kind of as an exercise. And it's, if you can take a minute in your journal, think about it. If you want to write something in the chat about it, we would love to have that supportive vibe. And when I ask patients during consults, what do you like most about yourself? It really hurts me when they shake their head and they say, nothing anymore, or I don't even know. Because when I see all of you, that's what I see. Is I see the gems that are buried underneath maybe a motor vehicle accident, or some failed surgeries, or a chronic disease like rheumatoid arthritis. Your gems are still there. It's not lost. It's just buried a little deeper. So we're going to dig down and look for that and clear up some of that that's going on, that's blocking you from really loving yourself and enjoying who you are. So what are some of the things that we're going to be talking about tonight? Can you relate? So as I always say, because cannabis is so individualized, you have to get to know yourself. You got to kind of come up with a little bit of a roadmap. So with your journal, you want to understand your goals. Maybe you want to do one symptom at a time. Maybe you want to start with just insomnia. Maybe you want to start with like daytime pain, or maybe just starting with being able to get through your physical therapy routine. Understanding your tolerance and what you can handle. And then here you are tonight. We're going to, start making some plans and help you find your gems. So some things that I'll be covering today, I almost made it like a, this board. It's easy, I think, things to stand out. Headaches, fibromyalgia, irritable bowel syndrome, depression, insomnia, arthritic pain, nerve pain, lack of joy, medication side effects, anxiety, failed back surgery, irritability, not really being able to be who we want to be, a lower quality of life, chronic Lyme disease, cancer pain, muscle spasms, spinal stenosis, disc degeneration, ulcerative colitis and Crohn's, and even mouths. So we're going to see how everything kind of gets covered. So at this time, I do want to introduce Dr. Prywis. Okay. Thank you, Tanya. So Dr. Prywis is a board-certified physician. He's been practicing in Danbury. He has specialties in physical medicine and pain rehabilitation, medical acupuncture, and integrative pain management. He has been serving on the Board of Physicians, the Medical Advisory Board for the Connecticut Medical Marijuana Program since 2015. He has great cannabis knowledge and really moves on that national platform with cannabis speaking events, really looking to educate providers and physicians on what makes cannabis medicine. And Dr. Prywis and I have worked together over the years on quite a few patient cases, and it's been remarkable to have a doctor from day one on our side. So thank you, Dr. Prywis, for your support for the dispensary, even when we are CCC, the little house in Bethel, for your support for the patients in the state, fighting for us at the board level. And thank you for being here. Hi.
Well, thank you for inviting me. This is very exciting. It's all very new for me. As I mentioned to you guys earlier, and we're all learning from each other. This is a new field for many physicians, including myself. As you mentioned, I've been on the board for the past 7 years now, and it's been a growth curve for me, and I learn a lot from my patients too. So. It's great to have this open to the community to be able to share my experiences and learn from my patients and learn from you. I guess I want to start off by saying what a unique program we have in Connecticut. I don't know how many of you have had the opportunity to travel around the country. I've been fortunate enough to go to medical cannabis conferences around the country and in Colorado and other states. And I have to tell you that we have a unique program here in Connecticut. Yes, we're finally getting recreational, but from a medical perspective, we're one of the few states, and perhaps one of the first states, to actually create this pharmaceutical model where you have professionals like USMA in every single dispensary in the state. Whether you realize it or not, each of the dispensaries are treated like a pharmaceutical, any pharmacy. That's not the case all around the country. And we have 4 producers in the state, and each of those producers are treated like a pharmaceutical company. So there's a very high bar for which the quality of the products and the legislation to put this all together. So I just want to tell you that you're in really, really good company, and it's very unique to have this kind of experience with USMA providing these type of webinars, which I think is great. And it's really a model for a lot of the programs around the country. So I just want to start off by telling you that. What do you want me to share? I mean, I don't know where to.
Yeah, I think that people might be curious about your experiences on the advisory board, maybe the process on how to get what you guys are responsible for. You can share that, and how you get new conditions onto the program.
Okay, it's interesting. The medical advisory board was created in a sense to have physicians, and it's comprised of 8 physicians. I'm the only doctor of physical medicine and rehabilitation. It's comprised that we have an oncologist, we have a surgeon, we have a pediatrician, we have a variety of pain management specialists on this board. And basically our role was to review potential qualifications for people to register. And what's happened over the years is it has evolved. We have, at last count, 40 qualifying conditions within the state for which you're eligible to participate for medical cannabis. And I believe there are 11 pediatric qualifying conditions too. In a sense, we've tried to make it easier for patients to be able to qualify. Perhaps in my practice, the most common condition is chronic pain. And I think if we look around the country, and even the neighboring states like New York, chronic pain, which classifies as anyone who has a chronic pain condition for more than 6 months, usually will qualify as a potential patient to be registered. But I have to tell you that it's really important that when I register patients, I do an exam, I do a history. I know that there are some doctors and practitioners who register patients who kind of rubber stamp their patients and say, okay, you have a diagnosis, let's rubber stamp you and go to the dispensary and get your card and talk to USMA. In my practice, what I found is that there's a lot of ways to treat patients who have chronic pain. As USMA mentioned, I'm an integrative medicine doctor. That is that I use a lot of alternative practices. I've looked at acupuncture, which I've been practicing for 25 years. I look at physical therapy. I look at osteopathic medicine. I look at a lot of different things. And when I interview a patient, I often ask them, what else have they tried besides, the prospects of surgery and pharmaceuticals? Because there are quite a lot of other alternatives that patients can benefit. And I have to say, medical cannabis is one tool in a very large bag, and it's not for everyone. It's not a panacea, but I found it extremely valuable particularly for patients who have, been frustrated because either they can't tolerate the medications, they're not working well for them, or their only options are surgery. So it is a very valuable tool as far as treating patients with chronic pain.
Yeah, like I always say, there's no magic bullet to health. You have to take care of your diet, you have to take the necessary supplements, and exercise, physical therapy, and some of the other things that you do. No, that was great. Thank you, Dr.
Right.
Breiwis.
Yeah,
Yeah,
I think. Yeah, I'm sorry. You mentioned nutrition, and that is essential. A lot of my patients, particularly the fibromyalgia patients that I see, I've learned I did an integrative medicine fellowship with Dr. Andrew Weil at the University of Arizona, and in that program, it was a 2-year fellowship. We learned a lot about nutrition, and very few physicians know about nutrition.
Yeah.
And so I've been able to realize that, food is medicine, and what you eat, what you put in your body often has an effect on your pain, has an effect on your mood. Just as cannabis, which is a botanical, has certain effects on your body and certain receptors. So, I look at nutrition, I do look at dietary supplements, I do look at lifestyle. All of those things are essential to promoting health, because it's not just about eliminating pain or just improving your mood. It really is about improving your overall health.
Yeah. Absolutely. Yeah. Thank you so much for sharing that, because again, it's all those tools you need in your toolbox to overcome some of these really hard disease states that are on our conditions list for the state. So yeah, absolutely. And then I think you also do follow-ups. How do you find your cannabis patients have been doing because I know that you see them every couple of months, not just yearly for the certification.
Right. Now, I think it's important to have a follow-up with my patients, because the reality is that they don't really have, other than you, Uzma, they really don't have very few doctors to be able to talk about their experiences with that. And, like you, we want it to be a successful experience for them.
Right.
I've often had patients who, I came back to me and said, I don't think I want to continue, or I don't think it's working out for me. And I would question them why, because if they don't have the proper follow-up in the beginning, if for instance, early on, I remember there was one patient who perhaps she wasn't taught properly how to use a lot of the cannabis that she got from the dispensary. And she had a terrible experience with it. She might have taken too much, and the general rule is start low and go slow. And
Right.
and she, did too many things, and she had a horrible experience and said, "Look, I never want to do this again." And so I think what Uzma and I are trying to do with patients is to make sure that they feel in a safe environment, to know that this is, not about getting high, it's about alleviating pain and improving your overall health and wellness. So we try to prevent that from happening with patients. We really
Absolutely.
want them to have a good experience with this. And, if it's going to work, you got to give it a good trial. Where I've seen it most effective is with patients who have chronic pain with neuropathy, cancer pain. A lot of our patients who are on cannabis do incredibly well who are on chemotherapy and neuropathy, and it's well supported in the literature.
Absolutely, we're going to be talking about that tonight. Yeah, I have something to go over, and even though it is so effective, and it's exactly what you said, it's sticking it out. It's you can't really improve nerve inflammation quickly, so it's sticking it out and having faith, right, that it's going to get better. And the patients who do stick it out, we do find to have better results. It's not always, I think when we think of marijuana, we think, oh, you smoke a joint, you feel better right away. Where it's just not the case. And we can fine tune it so well, which is what I'm going to discuss tonight.
Yeah.
But that's great that you're getting a lot of, you're seeing results with the nerve pain.
Right. The other point that I want to make, and I think this is an important point, is because very few physicians are aware or educated, because this is not part of the medical school curriculum, at least not yet. And most family doctors don't have any experiences. It's still important for you as a patient to discuss it with your doctor, to let them know that this is something that you're participating in or you have an interest in participating in. And, if they think that you're qualified, they will refer you to someone like me who will register you. I don't advise patients, I register them. And there's a difference, and I think it's really important. Your doctor, your oncologist, or your family doctor or your pain management doctor who's treating you for pain may say, I think marijuana or cannabis may be of value to you because the medications aren't working or you can't tolerate the medication for whatever reason. They would then refer you to me, and then I would contact their doctor. I would review the records and make sure that there's no contraindication for you to be on cannabis, because there are, and Uzma will testify this, there are certain medications that you have to know that can interact with CBD and some of the constituents in cannabis. We have to know that. And we also want to know that your doctors are on board, that they support you in doing this, because it's not just doing the follow-ups with me, because I'm going to see you for registration and I may see you in 3 to 6 months to make sure the program's going well. But it's your family doctor, your cardiologist, your gastroenterologist, all of them should be involved. And I typically, after I get a referral, I will contact your doctors or I will CC them on my notes so that they know. And I've been in this community, at least in Danbury, for over 30 years, and most of the doctors know me. And they know that, what I'm doing is to support their patients. So I think it's really important that you have that discussion, not be afraid, and they learn just as you learn together. And if they ever have questions, they can always contact me as well.
Yeah, absolutely. That's great. Thank you so much, Dr. Privis. I really appreciate you coming on today. So first, as I always do, I'm going to explain why cannabis is medicine, so you have a better understanding of what Dr. Privis was just talking about, and myself, the endocannabinoid system, and the different constituents of the plant. And we are going to focus tonight on why the full plant is better. So when we talk about synthetic cannabinoids, it's not something that people who are already in the cannabis community might be very interested. I completely agree with what Dr. Privis was saying, is that, from the whole plant is, of course, best. And also there's a sacred energy and sacred healing to the cannabis plant that I think a lot of us feel and agree with. And you're never going to get that in a lab. So I fully support natural phytocannabinoids. Okay, so cannabis is medicine. We're going to be talking about the phytocannabinoids, endogenous cannabinoids, and some of the receptors in our body that helps make cannabis medicine. So phytocannabinoids are the molecular components to the cannabis plant that fit into our cells' receptors and or affect our cannabinoid levels, resulting in physiological change. So THC is the most prominent phytocannabinoid to the cannabis plant. It is also the only one that causes a psychoactive effect, and there has been over 115 cannabinoids discovered. So CBD is the second most prominent component to the plant. Here in the program, we have THCA and CBN, which we will be discussing tonight in their product form. So they realized that these phytocannabinoids, these molecules that come from the cannabis plant, fit like a lock and key into these receptors that we have all over our body. So cannabinoid 1 receptors are the most prevalent receptor found in your central nervous system. So they're like the locks, and the cannabinoids, the THC, for example, comes like a key to connect to it and cause a physiological change. Cannabinoid 1 receptors are primarily found in the brain and the central nervous system, and also in other tissues. The cannabinoid 2 receptor is a little different. It's mostly in peripheral organs, but it's mostly in our immune system. So in our immune system, that's where it helps with inflammation and nerve inflammation. So keeping with the pain management topic tonight, I have a nice quote here: a unique opportunity to improve inflammation and worsening or damaging of our nerve cells can be offered with using the cannabinoid receptor. So both cannabinoid receptor subtypes, cannabinoid 1 and cannabinoid 2, are abundantly expressed in nerve cells and central and peripheral immune cells, and regulate degeneration and inflammation in diseases of the central nervous system. And that makes me think of when Dr. Priwas was saying he sees really good results with nerve pain and nerve issues. It's really interesting that there's no pharmaceutical on the market that can help with nerve inflammation or nerve degeneration, which is one of the reasons why they're exploring the endocannabinoid system so much. And going back to, I think it was Lorraine's question about synthetic cannabinoids, it's because there is a really strong need to help people find relief from neuropathy and nerve pain. And I think a lot of us on this call tonight will agree with that and can relate to that. So again, parts of the endocannabinoid system, the cannabinoid 1 and the cannabinoid 2 receptor, where THC and our other cannabinoids work on those receptors to cause that physiological change. So they were kind of scratching their heads and they said, why do we have receptors all over our body for molecules that come from a plant? Well, in the early 1990s, they actually discovered that we make our own cannabinoids. They're called endogenous cannabinoids because they come from the inside. So they named them anandamide and 2-AG. Anandamide is named after the Sanskrit word ananda, which is our bliss molecule, or it also means supreme joy. And what do these endogenous cannabinoids do? They help regulate our response to pain, which is what we're going to be talking about in detail tonight, and stimulate hunger. It plays a part in the brain's reward pathway. It can help regulate our mood and our emotions. It can help reduce anxiety and depression. There's strong anti-inflammatory agents and strong antioxidant agents, and it can help promote sleep. So it plays a strong part in our sleep-wake cycle. And so they put this all together and they discovered that we have an entire other system in our body, just like we have a cardiovascular system or an endocrine system. We also have the endocannabinoid system. It is a complex molecular signaling system that will kick into gear if we have any deviation, like an injury, an inflammatory response, any type of acute change, or even trauma. And the point of it is to maintain balance or just regulate the many physiological functions in our body. So it exists to reestablish normal levels and to act. Examples being an inflammatory response or even a fight or flight response. So some cannabis research. So according to High Times Magazine, cannabis researchers published 4,300 scientific papers in 2022 alone. The National Academy of Sciences, Engineering, and Medicine evaluated more than 10,000 scientific abstracts and established that there is conclusive or substantial evidence for the use of cannabis in treating chronic pain in adults. And the reason why I like to share this information is to empower you on your brave choice to use marijuana as your medicine. I know that there's still stigma. I know that your loved ones, your friends, your family members might be questioning why you choose to use marijuana for your pain and not understand so well. There's been decades of propaganda against this plant. So, just sharing knowledge gently, I think, can be very effective. You can always invite some of your loved ones on these calls so you can feel more understood, more heard, that just to be heard better by our loved ones and to be seen more thoroughly and understood, that's an important step in healing. And I don't want any of you to feel isolated or alone with your pain. And then on top of that, if you feel like you have to hide your cannabis usage or be judged for that, we don't want any of you to be going through that. So this is one of the reasons why we do these events. Okay, that was just a little side note. So about the research that's coming out, they've also discovered that our endocannabinoids, and we all know it's good for our mood, but they regulate our affective state. So not just if you're happy or sad, but even confidence and anger and guilt. And when you see a lot of studies that compare the success of opioids for pain relief, comparing it to cannabis, what I have seen often in the results is that cannabis is proving to be or can be more effective than opioids, not only for the actual pain relief, but also for the benefit of mood. So in that slide earlier on with that table, you know, there's irritability, there's depression. We don't want to be snapping at our loved ones. We don't want to be cranky all the time. We don't want to be down and out about what our kind of our body is going through. So helping that mood and relieving the pain, it's really a win-win. I've worked with patients, you know, maybe a husband and a wife, for example. Maybe the husband has I had a patient who's about like, I would say 12 years after a back injury. So he had a back injury 12 years prior to me meeting this couple, and he was really struggling with opioids and coming off of the opioids, and so trying to use medical marijuana. And it's almost like, you know, the spouse and the patient, they're actually both patients, because the caregiver stress and the caregiver worry is also very serious. So when you're taking care of someone who is ill, it's kind of better for everyone in the household when we can get you into being a little bit in a better mood. So then you see relationships start blossoming again. One wife, this patient's wife, had told me that, oh, I feel like I have my husband back finally. I didn't think I'd see him again. And that's really why we love to do what we do. Okay, so the endocannabinoid system and pain. So it's pretty amazing that the endocannabinoid system actually helps regulate every part of the very complex pain processing pathway in the human body. So this is just some information. So if you look at the little chart here, when you have pain and the pain signal is going to get sent to your central nervous system, your brain is going to interpret those signals, and then you kind of decide what to do, right? Like maybe you pull your finger right away from the fire. So our endocannabinoids and then supplementing our endocannabinoid system with cannabis can help modulate or regulate all the stages of our pain processing pathway. So it does get complicated. I want you to know this because I think that all of us have probably heard that oh, cannabis just makes you forget about your pain, or cannabis just makes you like pretend that your pain isn't there. That is not true. When you find pain relief from cannabis, I want you to know that it's not just in your head. It is in your head. It's working in your central nervous system, but we have the actual information as to why it works now. And I think that's pretty cool. So the cannabinoid 1 receptor and pain. Just a couple of facts. I'm going to try to keep it brief because I know that we want to get to a product review where I really get into how we're going to be using these things. So the cannabinoid 1 receptor is strategically located in regions of our peripheral and central nervous system where pain signaling is intricately controlled. And this receptor tells signaling molecules what to do. And they act like traffic cops to control the levels and activity of most of the other neurotransmitters. Those are messengers that tell nerve cells, neurotransmitters to turn on or off. And this is how they regulate things by immediate feedback, turning up or down the activity of whichever system needs to be adjusted. A little bit about the cannabinoid 2 receptor. I found this really interesting. If any patients on the call are struggling with any type of autoimmune arthritis, that include rheumatoid arthritis or psoriatic arthritis, which are both qualifying conditions, So you're looking at your immune system and you're looking at inflammation. And as I stated earlier, they're finding with the research that cannabinoids can modulate inflammation as well as our immune cell behavior. So cannabinoid 2 receptors will pop up when inflammation starts to regulate the way nerve cells and immune cells communicate with one another and reduce pain and inflammation. So I came across an interesting study that was done on mice with a rheumatoid arthritis model. And they saw a reduction in arthritis scores, a reduction of pro-inflammatory cells. And what I think is really fascinating with rheumatoid arthritis is a reduction in bone destruction. In another study, they found reduced swelling, reduced joint inflammation, and again, less joint destruction. Now, when we look at these studies, definitely gets me excited that we're pointing in the right direction. This in no way translates to there's no studies out there with recommending dosing or recommending how much to use when. That's where our experience at the dispensary comes in. So that's where how Dr. Prywis has said, and I've always said, I learned so much from my patients. We're really working together and evolving and progressing on this amazing journey of what we're doing here. So this is something that's like it's a nice guiding point, but I don't want you guys to think that it's translating yet into any type of dosing parameters. That's something that we have worked out with our experience with our patients as we've been doing this here in Connecticut. So I want to talk about CBD. CBD, I learned a couple of things that I thought was pretty amazing. And it seems that CBD is interacting with more targets in our body than just the CB1 and CB2 receptor. And if you guys have been on these calls before, and I've said this a couple of times, that I find that patients who use THC only plateau and patients who do CBD only plateau. And I found some interesting information that actually supports what I've seen over the past couple of years. Is that the CBD works differently in the body than the THC, and them working together, you get really remarkable outcomes. The CBD is a very strong antioxidant. It's an anti-inflammatory. It has been shown to increase the levels of our naturally occurring cannabinoid anandamide. And what they did, I thought this was pretty interesting. This was also a study done on mice with a model of nerve pain. And so they used a cannabis extract containing cannabinoids, terpenes, and flavonoids. So again, we're talking about a full plant extract. And that demonstrated better pain relief than a single cannabinoid given alone. And that shows us that you can get better pain relief using multiple cannabinoids as well as having terpenes in your therapy. And so I thought that was pretty cool. And then the final statement is pretty fascinating. So that pain relief effect did not involve the cannabinoid receptors. It was actually using another receptor in our body. And they are saying that this pain relief, this unique type of pain relief, is coming from CBD. So we're going to talk about some CBD products if you've not incorporated CBD into your routine yet. Also managing your expectations with CBD. If you're used to only using THC, CBD is going to feel way different. CBD is not psychoactive. What I like to tell you is pay attention to what you don't feel with CBD, not what you do feel. And that can be a little tricky. So you want to check in with yourself throughout the day and just see what you're not feeling. And keep a journal. So what were you feeling maybe last week that you're not feeling this week? So when I'm speaking with patients and I keep track of their symptoms and also the descriptive words that we use to describe our pain and symptoms. And then if I do a follow-up and I'll say, how is X, Y, or Z, or are you still waking up with your teeth clenched? And, patient said, oh my God, I haven't had that for about a week and a half now. Because sometimes when a symptom disappears, it's great if you forget that you ever had it. But we definitely want to keep track of how you're doing. So I'm a big supporter of journaling if you're starting or planning on starting any new regimen, so we can really have a good marker for your outcome. I hope that makes sense. So now talking about that synergistic effect that Dr. Prywitz also mentioned, when you take all the parts of the plant and you can put it together and get a full benefit. Full plant and more cannabinoids are definitely integral for better outcomes. Now, what's interesting though, is that the full spectrum products in Connecticut still are very potent in THC. So it's hard for most patients to tolerate that type of a product. And if you're taking such a small amount, well, you're not getting enough of the other cannabinoids either. So I have found that using targeted cannabinoid therapy, so maybe you use your CBD product, you use your CBN product, maybe you use a THCA product and a topical. So using that targeted cannabinoid therapy, and in that 24-hour period, you're using multiple cannabinoids, you're going to get that benefit. Again, like I said, I see patients do better when they do incorporate other cannabinoids into their routine. So right now with the products in Connecticut, using the cannabinoids separately is the best option. And I have seen it work really, really well for a lot of patients. Okay, so here are some CBD only products. Advantages to CBD only products is that there's no psychoactive effect, there's no THC in it, and that is something that you can use during the day. I find that sometimes a lot of patients aren't sure what to use during the day for pain relief because, of course, we want to avoid that psychoactive effect. And unfortunately, then a lot of patients will not use anything during the day. And maybe when they come home from work or at night after their kids go to sleep, they might use a THC product, find a little bit of relief and get some sleep. I mean, and that's great. That can be an improvement to what they had before, but it's not using the full benefit of the program. So I find that talking to your pharmacist, talking to your technicians at the dispensary, and just being here tonight is a good way to get an understanding, because I know these products are so confusing on our menu. So that's why I love to review the products. So this time I put the products onto slides. I know I usually share my screen and go through one of our store's menus. So let me know if you like this better, and then we'll do it the way you guys like better for the next time. But I found that going back and forth was starting to get a little distracting. So let me know what you guys think of this setup. Okay, so first product here, we have the CBD high potency drops from CT Pharma. And there's no THC in them whatsoever. It's really a hemp strain. It's available in a 15 ml bottle. The whole bottle has 787 milligrams of CBD and about 52 milligrams of CBD per ml. The droppers are generally marked at 0.25, 0.5, and 0.75. So you can be really flexible with your dosing. Maybe you need 1 ml in the morning if you wake up really stiff with fibromyalgia pain or other types of pain, rheumatoid arthritis, you have that stiffness. Maybe you can use something as soon as you get up in the morning or even from your bedside. That doesn't mean you need to use that full milliliter every time you take it. You can even use a smaller amount throughout the day to keep that effect steady. So I'm just giving you guys some tips and tricks on how to use your medication. Chewable tablets. This is from the same strain as these high potency drops from CT Pharma. They come in 5 milligrams, 10 milligrams, 40, 50 milligram extended release, and 100 milligrams. And you can chew them. And these are very convenient as well. If you're not sure about what dose you should use, definitely schedule an appointment with one of your pharmacists or speak to us at the counter. We would love to direct you. AGL also makes a CBD solution. There are trace amounts of THC in this, so it's a different extraction, different plant from those CBD high potency drops from CT Pharma. So the cannabidiol eye CBD oral solution delivers in 1 milliliter delivers about 30 milligrams of CBD. And good results from all of these products. Okay, so now these are some of those minor cannabinoid products that we were discussing back here in this slide. Okay, so we're going to do some THC, and some CBN here. Okay, so over here on the top left, we have the CBN chewable tablets from CT Pharma. I I've been really excited about this product when it came out, and I'm really excited about the results and outcomes we're seeing, as it's so much more versatile than we originally thought it would be. CBN is a cannabinoid that comes from, if you have flower from a year or two ago, most of your THC has naturally degraded to CBN, cannabidiol. It's a lesser non-psychoactive cannabinoid that we kind of call it the sleepy cannabinoid, that if THC you get that medicated feeling and then you fall asleep. With CBN, you'll probably just get sleepy and fall asleep. So this is a really versatile product in that it's great for sleep for some patients. Each tablet contains 11 milligrams of CBN and 2 milligrams of THC, which means, and you can cut them in half. So starting with maybe a half of a tablet for a couple of nights if you're not getting the relief you need, increasing to a full tablet. I've had patients take this and maybe a 5 milligram THC tablet, so that's 7 milligrams of THC, 11 milligrams of CBN. Again, being flexible with how you medicate. What's been exciting about using the CBN product is seeing that patients have been able to use it for other purposes rather than just insomnia. So using it for tremors, using it for spasms, and even using it for anxiety that of course comes with having so much pain. So exploring the use of other non-psychoactive cannabinoids besides CBD, I think has been really exciting the last couple of months. Over here on the right, we have the Hybridol THCA oral solution. It's a little acid attached to the THC molecule, which we believe prevents it from crossing into the blood-brain barrier, so you don't get the buzzed medicated feeling. So THCA can give you the medicinal benefits of THC without that head high. This particular product has a touch of THC in it, so please be aware, depending on your tolerance and your preferences. Each ml will deliver just under 30 milligrams of THCA and 4.58 milligrams of THC. Again, you can use 0.25 to start and do a slow, safe titration upwards. So THCA, I've had patients have really good results with anxiety, nerve pain, and even just types of arthritic pain. So if you find that CBD might not really be sufficient for you, you want to maybe have a different feeling and explore that, the THCA oral solution is a great choice. And that touch of THC just can help relieve those symptoms. Here on the lower left, CT Pharma also makes a THCA product. This is a THCA oral spray. So one spray delivers 2.9 milligrams of THCA and only 0.2 milligrams of THC. So this is a cold extraction, actually. THCA is how your THC is present in your flower before you light it. Once you light it, that THCA converts to THC and becomes psychoactive. So they make the THCA with a cold extraction, and we just ask that you don't leave it in your car on a hot summer day with the possibility of it converting to THC and maybe giving you a buzz that you didn't expect. So the THCA oral spray, again, you're going to look at your tolerance and what you're looking for and see which product you'd like to try if this is something that you're thinking about. The oral sprays are made with an alcohol base. If you have a condition, if you maybe have mouth sores from a cancer chemotherapy treatment, I would avoid the sprays. The solutions are made with a coconut oil that tend to be very soothing. I'll just touch on this now, but I have used the THCA oral solution for patients with cancer mouth sores, to swish and swallow or swish and spit, again, depending on the tolerance. I even had a patient who combined it with their lidocaine viscous. If you guys are familiar with that, it's a numbing agent. Had really good results with that. So definitely talk to us if that's something that you're looking to heal. Now we have a vape with CBN in it also. The first time AGL made this, they did make it with an indica blend. The second batch they made with a hybrid blend, and I have seen a pretty big difference. And we're going to talk about terpenes here for a few minutes also. So this is the Hybridol 5:1 THC CBN vape from AGL. It's a 0.5 gram cart. And here they'll do, it's mostly THC. So 5 parts THC, 1 part CBN. And CBN our patients are coming back and telling us how soothing it is mentally and physically. Because it's 5 parts THC, depending on your tolerance, I would not say that this is not going to be psychoactive. So you definitely want to experiment at home, how many puffs are you comfortable with, and again, journal that so you know for the future. So let's look at the terpenes now. So terpenes are the aromatic parts of the plant that are measured and tested in Connecticut, which is great because they don't do that in most states. And they can help us along with the strain and the cannabinoid content. The terpene content will let us know how that particular harvest or that particular vape oil is going to hit. So if it's going to be great for focus and motivation, or is it going to settle into the body and give us some couch lock? So with this terpene analysis, I see here that the limonene is 0.45. So generally patients tell us anything over 0.2% will have an effect. So limonene, patients will tell us that it's joyous, it's energizing. You think of almost like when you smell a lemon peel. But then look at what's next to it. I think this is great. The linalool, 0.87%. Linalool comes from lavender. We do associate lavender with rest and calm. And then 1.19% beta caryophyllene. Beta caryophyllene you can find in black pepper. What's also interesting, it almost works like a cannabinoid because it does fit into our cannabinoid receptors. And that's great for patients tell us that couch lock pain relieving feeling. So I feel like I would describe this as being very zen, happy. So you're happy, but you're calm and your body's feeling good. It's not like a strong sativa where you're going to be happy and want to maybe dance or clean your house. It's going to be that zen, happy, chill, and you're going to have relief. And again, it's just interesting to explore other cannabinoids in the vape form. Of course, it's different from ingesting something that can be measured in milligrams. So, it would be something interesting if, you tried the CBN tablets and you tried the vape and see how it feels different because it does get metabolized and work in the body differently. All right, let's just keep moving. I hope everyone's still doing well. I'm going to talk about migraines, IBS, and fibromyalgia. This is really interesting, and it's the theory of clinical endocannabinoid deficiency, and it really changed how we practice medical cannabis here in Connecticut. It's a theory from Dr. Ethan Russo, who has done really remarkable things for cannabis as medicine. And he tied together 3 mysterious or puzzling disease states to Western medicine: migraines, irritable bowel syndrome, and fibromyalgia. So the theory is, right, it starts off with when I told you earlier that your endocannabinoid system plays a part and is responsible for maintaining a normal pain threshold. Well, if we don't have a well-functioning endocannabinoid system, or if we have a low endocannabinoid tone, it would make sense then that we might see different types of diseases. And an increased pain, hyperalgesia, disease states make sense. So with migraines is actually a diagnosis of exclusion. I know this is so hard for our lovely patients who've been dealing with migraines for 10 or 20 years, or fibro pain for decades, is that you've gone to so many doctors and you've tried so many therapies and you haven't found the relief that you're looking for. Dr. Ethan Russo put together the theory of clinical endocannabinoid deficiency, that if we can supplement our endocannabinoid system, that should help relieve migraines, IBS, and fibro. And patients who come in with a migraine certification, right, intractable headache syndrome, I will always ask them, how are your bowels? Have you ever been diagnosed with fibromyalgia? I find that most patients do have 2 out of the 3. And when we start supplementing the endocannabinoid system for any of these symptoms, we do see a reduction. I've seen this with a lot of patients, a reduction in frequency and severity of symptoms. So again, going back to when I was talking about that sativa strain question, is that using something for kind of the long-term goal. So that could be something like 40 milligram CBD tablet during the day and 5 milligrams of THC at night. I've had patients do that for as little as 10 days and seeing a decrease in their migraines. On top of that, you'll need something for your breakthrough pain or for your immediate symptoms. So it's gently supplementing your endocannabinoid system, and then also having the tools in your toolbox for if a migraine is about to come on, or if you're fibro pain, if you're having a flare. So again, all of the things that we are talking about do apply to migraines, IBS, and fibromyalgia. This is one of the reasons why it's on the qualifying condition list. And also because unfortunately patients with these conditions don't find relief from regular pharmaceuticals. So yeah, this is definitely something that I like to talk about, and I like to talk about with patients, and we can do a lot. And I know that, you know, it's been hard when you've been suffering like this. So please schedule an appointment, because like Dr. Primus was saying, we want the program to be a success for all of you and for as many people as we can help. That's why we're all here. Now we're going to talk a little bit more about nerve pain. Now, when it comes to cancer pain, a couple of things that I want to talk about. There's the nerve pain that is associated with the damaging effects of chemotherapy. Joint pain, the mouth sores we discussed a little bit, fatigue, bone pain, and brain fog even, is really because of the inflammation that the chemotherapy could be causing. So the nerve pain that could come from cancer chemotherapy, it can be treated the same way that we would treat nerve pain as it is. I'm just going to check something here because I'm wondering if, I know we changed the order a little bit. Okay, so I want to talk about this right now. This is chemotherapy-induced peripheral neuropathy. This affects so many people. For some people, it stops or reverses when the chemotherapy is stopped. And for other people, it can continue to go on for years or even decades. So they did do a study on mice where they showed that a really common chemotherapy drug called cisplatin actually reduced the naturally occurring anandamide, that the levels of our naturally occurring cannabinoids. And again, cannabinoids, we learned, are there to protect the integrity of our nerve cells, to prevent degeneration and to prevent inflammation. So again, if that is not functioning well, then we're more open to nerve pain and nerve damage. And they did also do a study with CBD and a chemo agent called paclitaxel, and it showed that CBD was actually protective against PAC-induced neurotoxicity. That means using CBD, I have found in higher doses while undergoing chemotherapy could potentially protect your body from some of those ionizing damaging effects. And we also help people who have maybe completed their chemotherapy or still struggling with neuropathy. I do see a lot of patients coming with that as their chief complaint, and us trying and working hard to get them better. So the high doses of CBD, this is some of the products that I would recommend. The Summit CBD RSO, again, that full plant extract. This is 613 milligrams. It's actually 745 milligrams of CBD when you add the CBDA and the CBD together, and only about 30 milligrams of THC. So it is a bit of a sticky product. And this I like to use in higher doses if you are having a rough time with the chemotherapy and the tingling of your hands and feet, perhaps. I had a patient recently who was struggling with this, especially in her toes at night, and she couldn't sleep. We chose to do a topical. I had her cover her feet and her toes in saran wrap and put socks on. And she said the first night, she said she felt better and she was able to sleep. So I thought that was pretty cool. And then there's a 3-to-1 tincture also from Theraplant. It's 3 parts CBD and 1 part THC. So that's something interesting to look into as well. Okay, so I'm going to keep going with the products. It's 8:20. How is everybody doing? I knew this would be a big one. Tanya and Shane, where are we at?
I'm good.
Okay, everybody still feeling good out there?
Feeling well, but there are more questions coming in.
Okay, so let's do, we
questions.
can skip a couple of things. There's a couple of things that I know I didn't. You know what? You guys could screenshot these probably, if you want, but go ahead with the questions, Tanya.
Are these products helpful for Raynaud's as well?
It can be, yeah. So it can be. If it's mostly in your hands, so the endocannabinoid system is responsible for a couple of things, right? Our nerve signaling as well as our temperature control. So I'm curious to see if using a combination of the CBD, maybe a low dose THC at night, and then some topicals, I think that we should definitely try it out and see where that goes.
Is it safe to compare smoke shop CBD to medical CBD for pain from a dispensary?
That is a great question. We have a lot of patients who will come in and say, oh, I tried CBD and it didn't do anything. Unfortunately, the over-the-counter CBD market is completely unregulated. And it could say 25 milligrams of CBD, and it could literally have nothing in it. A lot of times the front labels don't match the back labels of those products. So when patients try our CBD, they find a significant difference, whether it be a topical or a vape or any of the solutions. So the CBD products that you're getting in the program in Connecticut are definitely better than smoke shop CBD. There are some wonderful CBD brands and really great hemp farmers out there making wonderful medication. So you definitely want to make sure that maybe they've been evaluated by some independent groups. So do your due diligence.
And it seems that Kathy has a question about nerve pain.
Okay, perfect, because I have a slide up right now on nerve pain, so that will bring us into that. What's Kathy's question?
She just didn't want you to. Sorry, Kathy.
Don't skip over. Yeah, don't skip over this part. This is I've been suffering with chemical CIPN for a long time, so please don't skip over it.
Okay. Yeah, this is the part that I wanted to get to. So thank you, Kathy. So nerve inflammation and nerve degeneration, there is actually no pharmaceutical that works as a neuroprotectant or a neuro pain reliever on the market. And to go back to that original question that was just perfect, I think her name was Lorraine, about the synthetic cannabinoids and what they're researching. That's one of the reasons why I think they're really looking into this, is to find some solutions for nerve pain and nerve damage. So the research that's coming out from that definitely helps us. So CB1 receptor activation, so the CB1 receptor is mostly in your central nervous system, has been shown to protect your nerve cells from acute brain injury, as well as neuroinflammatory conditions and neurodegenerative diseases, such as ALS, MS, Alzheimer's, chemotherapy, and brain injury. This is absolutely remarkable, especially because they used to tell us that marijuana kills your brain cells. It actually turns out, it's seeming from some of this studies, that the opposite could be true. So moving forward from that, and what are we doing with that information? So they did a study here that, and it wasn't on people, it was on mice. Our results suggest that an ultra low dose of THC, they were saying that lacks any psychotropic effect, protects the brain from nerve inflammation, induced cognitive damage, and might be used as an effective drug for the treatment of neuroinflammatory conditions, including neurodegenerative diseases. A lot of us who are struggling with pain, we're trying different medications. Maybe we're trying, we tried Lyrica, and then the doctor said, okay, try Cymbalta. Okay, here's a muscle relaxer. Okay, maybe you need some Valium. Though the mechanism of action of those medications are not going to be treating your nerve inflammation or preventing nerve degeneration. That's just not how those drugs work. So this is really exciting. And what I thought was pretty amazing is, because THC is so hard to tolerate for a lot of people, It's another reason why they're doing a lot of research on cannabinoids, is to get that benefit of THC without that medicated high feeling. This was showing that you can take that low dose and have so much benefit. So this study is saying that that dose right before you get high is the dose that could be really effective for nerve inflammation and nerve degeneration. And a lot of patients that I'll work with, I like to recommend, even if you are sleeping through the night and you're one of those people who can sleep through the night without anything, that's great. If you do not enjoy the feeling of THC, please take, of course, speak to one of us, 2.5 or 5 milligram tablet or capsule or spray even when you go to bed. Let the THC do what it needs to do in your body while you're sleeping, and you can sleep off that head high that you may not prefer for the daytime. So some of the tablets, these are some of the lower dose products that we have. We have a 2.5 sativa chewable microdose. So maybe that's a right dose for you for during the day, depending on your lifestyle. So you may choose a sativa and use that during the day. We have a 5 milligram hybrid capsule from TheraPlant called Bogoti. We have the Indicol micro tablets from AGL. They're 5 milligrams per tablet. And the relief drops here, I wanted to just include, it's mostly CBD and THC with some extra terpenes of beta-myrcene and beta-caryophyllene for pain relief. And you can, again, use a quarter or half of a milliliter to get that low dose and get some pain relief and CBD into your system. So really the message for tonight, and I wanted to say it again, it may seem confusing, is that there's a lot of literature and support for using cannabis for different types of chronic pain, autoimmune arthritises, cancer pain, cancer neuropathy, other types of nerve pain, degenerative diseases, and nerve inflammatory diseases and arthritic diseases, helping our body regulate the way we process pain. And again, it helps with our mood and our emotion. And what we've also learned tonight is that using different cannabinoids from the plant will give us more relief, and not just relief. It's not just up here, it's actually healing your body. And that's the message that I wanted to give you guys today. So please speak to your technicians, speak to your pharmacist. You can schedule a consult that is available in the survey, and reach out to us. You can always just call the front desk at your dispensary. And we'd love to work with you, because again, we want you to succeed on this program. So full spectrum products currently in Connecticut are very potent in THC and hard to tolerate for most patients. You'll find a little bit of CBG in something like the 360X hybrid syringe from TheraPlant, but there's also a lot of THC in there. So if you can't tolerate that much THC and you're only taking maybe a little speck, you're not getting that much CBG. CT Pharma was making CBG drops for a little while. They unfortunately stopped. We also need providers and education so we all know how to use these minor cannabinoids. So hopefully that will come back. But again, CBG is something that you could potentially get from an outside source. You don't need your card to get something like CBD or CBG. And then combining it with THC from the program, I think is the best way to go. So currently no CBG products. Yes, it does cross the blood-brain barrier, and it's a great cannabinoid. It's actually the cannabinoid that is the parent cannabinoid of THC and CBD. So that's kind of cool. I want to say thank you to Dr. Prywis. I want to say thank you to Shane. Thank you, Tanya. And thank you to all of you. I appreciate your support. And I know that this was a really big topic. I hope it was okay and this was beneficial for you.